Technical team, can we stop the video now? Right. Good evening, everyone. I would just like to walk you through the housekeeping rules before we start. So all participants' video and audio would be off during the event. Only the panelists' video and audio would be allowed. All the questions need to be addressed to my co-host Varsha, in front of whose name question and answers is mentioned. And all the questions need to be addressed in the chat box. You can do that through the course of the event. And we'll be addressing all the questions in the question answer session laid out at the end of it. Lastly, I would like to inform you that this event is live and will be getting live streamed on the India Migration Now Facebook page. To start off, I would like to welcome you all to India Migration Fellowship's Mainstreaming Migration in India webinar series. I'll be the moderator for the day. My name is Harshita Sinha, and I'm a migrant fellow with India Migration Now and Bandhu Urban Tech. I'm also doing my PhD at the London School of Economics, working on internal migration in India. The India Migration Fellowship has been curated by India Migration Now and Bandhu Urban Tech as an initiative to promote ecosystem thinking among budding researchers and also aid an intersection of research and operations in the Indian migration ecosystem. To briefly walk you through how this webinar series came into curation, through the course of the COVID-19 pandemic, there's been a turning point for India towards how they understand and conceptualize internal migrants. Internal migrants are estimated at roughly 400 million in the space of India, and they account for a growing share of India's informal labor force. The migrant crisis and the pandemic that ensued has posed a critical question of how migrants are represented not only in the policy domain, but also in the development ecosystem in large in case of India. Through the course of fellowship, both Varsha and I, my co-fellow, through the course of this the 6 months period in the fellowship, spoke to numerous specialist programming teams and development practitioners, which revealed a growing need for an operational perspective on migration in India. Much like the other programming domains that are present in the development space in India, like gender, health, WASH, etc., migration itself is a evolving domain in this space. Through the course of this webinar series, we aim to unpack the prospects, potential, and challenges that the CSO and the other stakeholders in the ecosystem are facing when addressing intervention towards migrant workers. By bringing CSOs, funding agencies, practitioners, and knowledge partners on the same panel, this series aims to unpack conversation and develop action plan towards mainstreaming and de-risking migration. In our panel today, we aim to unpack the current diversity and heterogeneity in approaches that the CSOs have taken in the Indian ecosystem towards creating programs and intervention for migrant workers. By bringing the grounded experiences of different CSOs in the space, the panel aims to further a knowledge sharing opportunities and create a knowledge sharing platform through which the different CSOs and the avenues in which they are addressing migrants' needs can be brought on the same table. Through this course, we also aim to develop and discuss a de-risking framework that can be potentially discussed in case of India. Without further ado, I would like to welcome our panelists for the day, who have been extremely encouraging and supporting in helping us put this panel together. I would like to welcome Dr. S. Irudaya Rajan, founder chairman of International Institute of Migration and Development in India, and also the former professor of Center for Development Studies. Mr. Libby Johnson, executive director of Gram Vikas and a development migrant management specialist with 25 years of experience at both grassroots and policy level in the government and non-government sector. Mr. Umi Daniel, who is the Director, Migration and Education Aid at Action International. And Umi has been formidable in his work on education for migrant children, seasonal hostels, and the right and entitlements of migrant laborers. Hitesh Kukreja, who is the state lead for Indus Action, where he's currently leading and supporting the Delhi government's program in improving welfare delivery for construction workers. Mr. Varun Kapil, who is the regional manager, Tata Trust, and the executive director for Lever Link Foundation in Odisha. His work with Tata Trust has been to create a novel initiative for addressing maternal and child healthcare facilities for migrant children in Brooklyn work and near their work sites. Thank you all for joining us and being part of this initiative. As we begin today's panel to discuss how to mainstream and de-risk migration for low-income households in India, I would first like to begin with addressing this question to Dr. Rajan. In an attempt to set the overview for this panel, could you please help us understand the way migrants have been conceptualized in both the policy and CSO domains? And does the terminology internal migrants comprehensively capture the heterogeneity and diversity that the lived experience of migrants, especially when we're talking about mainstreaming migration in policy and operationalization, brings to the table? So.
Thank you so much, Karshida, for the invitation and to be part of the India Migration Now, which I am also with them for quite some time when it was started from the few years back. I just wanted to start by asking, who is migrant? I think that is where still it's like I was remembering in one of the reading in the Bible, who is your neighbor? And for that, there's a big story there. Now, who is migrant? We don't know still. I'm not sure we know that. But if you look at the definition of migrants, which we use some data, because of course, Karshida told us 400 million. My estimate is 600 million people are migrants internally in this country. This is based on the single definition, which is the people living in a place they are not born. This is a simple definition based on the census. People living in a place they are not born. We use it as a place of birth concept. We also have another concept called place of last residence. Where did you live last year? So then we have a duration of residence in the census data, which also gives you similar number, basically, similar number. So 600 million people are living in a place they are not born. It includes me. I am from Tamil Nadu, now migrated to Kerala. It includes not only me, it includes our Honorable Prime Minister of India. He's a migrant from Gujarat to Delhi. So it is not just we are migrants. 600 million people are migrants. Why the migrants we don't know still? Because the migrants provides, which is a very challenging task. It gives both economic and social mobility. When you go to city, nobody is going to ask what is your cost. You go to city, they are not going to, you are going to earn more money than what you are earning in the villages. The NREG wages we know, but the wages, today I was talking to somebody, a worker who came from Orissa in my state, in Kerala, because Kerala is full of migrants anyway. We had close to 3 million people they are talking about. And they said they are earning 1,000 rupees per month. Whereas he said in my state, I get only 200 rupees. And that is only for maybe 6 days or 10 days. I'm getting here 30 days. I can overwork. I can earn easily 50,000 rupees in Kerala if I'm willing to work. Because the migrants are doing what I call them dirty, dangerous, and demeaning jobs. So the definition of migration is, I think we don't have any database, no idea how many are there. That is partly because nobody interested in migration. I think we should keep this in mind. Migration is, I don't think anybody's cup of tea. I think we are only talking. I think we are all talking because of COVID-19. COVID-19 exposed them. It is not they were never existed. It exposed all of us, opened all of our eyes, including the media, including the people. Otherwise, I don't see that migration was part of anything, any big research thing. I was talking to the NFHS people a few minutes back. NFHS, which has recently released, they talk about a lot of data. I told them I had a few questions on migration. They were not interested. And in fact, the NFHS one, they were asking only to females. They didn't ask males. Family health includes male and female. They talked to only women. Of course, after a long time, they started talking to men. So I think we should get a right database on migration. I think that is completely missing. Once you have no data, you are walking in the darkness. In that darkness, evidence-based policy, mainstreaming migration into development will be a great task. Because how many economic review up in this country with different states, you have a chapter on migration. You ask them, except Kerala, you have a chapter because we give some data. Unless you imagine that particular point, How to mainstream migration means you should have a chapter in your economic state level economic report. Can we influence? Can we influence a chapter in every state economic review, state report, state development report, even state development report I have seen in many states. Nothing on migration. If you ask them why, no data. You have data on everything, but not on migration. But they are the pillar of growth. They are the pillar of economic development. When you talk about smart cities, smart city means migration. Nobody talks about that. So I think we have to wake up first. We are all sleeping. All of us are sleeping. Policymakers, except the politicians who are very awake on migration. Yeah, for them, they are not even vote bank. So they are not bothered. They are not vote bank, except sometimes. So that the definition of migration is a big question. Once you define them, then you can talk about their streams, rural, urban, inter-district, intra-district, interstate. Then you have a lot of layers, informal work, formal work, like long term, short term. I came to Kerala as a short-term migrant. 1 year I thought I'll stay and go back. Now I am a long-term, I am a permanent. And I was not affected during COVID-19. So you have to have a lot of layers. For that, you need a very clear-cut data. I think the international funding agencies, even today, I'm very sad to say, they are funding research to do survey on fertility. Fertility, what are you going to do with fertility? When the country has 2.10, but you are still talking, pouring money to have next NFHS. What are you going to learn from that? Except making some political statements. I think we have to change. Funding agencies to wake up. You should then, you put funding. Can you put a good database on how many domestic workers move? Can you put the data? Nobody has data. Everybody, not even estimates are available. Very sad. Estimates not available. Forget about estimates. We are in that stage. I think unless you do this, getting the correct database on migration, moving from small city to big city to a mega city, like there's a progression in migration. We never look at it. There is like a parity progression. You have first child, then second child, third child. You cannot go to the third child without the first child. So you have to have progress. People move to small city, village to small city, then we go to Mumbai. People move. So you have to do, there's a highly dynamics of migration. I think we should look at it very carefully. Unless we do that, we'll be talking the same thing even after 50 years. I'll stop here.
Right. So point duly taken in terms of the data sets that you mentioned and the lack of proper data set availability that is there. I think drawing on the point that you said that given the diversity on how itself we define migrants and the dynamics that are associated with it, when we are having a conversation around de-risking, specifically de-risking of low-income households, would you like to share some of the insights from other contexts or in relation to India, where you think when we are talking about low-income households specifically and the de-risking initiatives that are coming with it, even with the limited data sets, what are the things that need to be kept in mind? Alongside developing a data set, what is it for a de-risking framework that needs to be kept in mind? If you could address that.
Yeah, I think I will speak maybe 2-3 minutes. I think that, when you talk about low income migrant household, probably 70 million people in this country, some approximation, low income. That's why somebody told me when the lockdown was announced, I have no money. I am not saving for tomorrow. That's why they were walking to reach home because they had no money. So I think we are talking about very low income, illiterate, minorities, scheduled caste, scheduled tribe, who are really what we call the vulnerable migrants. Anyway, vulnerable migrants. I think for that, they should carry over their benefits wherever they go. I think something we should talk about that. Can they carry their benefits? Take the RSPY health program. Take the RISE or the PDS. So we should think of, we are talking about ration card, but I know how the ration card is functioning. I know that. So please remember that. Can we take them? You get the same benefits even you move. Can we move like your mobile? I was talking to the Ministry of Urban Affairs. Can we have a card called migration card? You have a lot of cards in this country, which are all waste anyway, including Aadhaar. So if you can imagine a card, a migration card, you can sweep it. Like we are doing ATM card. You are doing a mobile card. When you move, mobile is moving. Wherever you are there, you are calling. Similarly, can you imagine something to get this low income household in a big bracket so that they can get some benefits? For that, you need a benchmark. You need a benchmark. That's why the crisis has given us opportunity. I think we should utilize that. For example, again, give an example from Kerala where I sit. I was, in fact, for example, I was part of the advising the government for the COVID-19. And many people call me, why you are there? You are not belong to the political party. I said, I belong to the migration party. Because you only stopped the people to move. What did you do by lockdown? Don't move. That means I have to be there. How to make the people move? Otherwise, what is that? I'm not there to put vaccination for them. I am here how to release the unlock down as early as possible in Kerala. We did it, unlock down, because we cannot move, because that's a livelihood issue. These are the poor migrants. For them, migration as a livelihood strategy for them. I think for that, at least now there are agencies are sitting here, people can talk to them. We should imagine, for example, I did a Kerala migration survey for so many years. Now Kerala government wrote to the Supreme Court saying that we have enough beds ready for bringing the people from abroad because we had a database. So I think we should think of, we have done the survey, which gives you a lot of database on the low income household. You can think of that. We have done it in Kerala, moved to Gujarat, Punjab, and Goa and Tamil Nadu. We have done in 5 states, and we are thinking of 3-4 states. But my dream is like a national family survey. There should be a national migration survey at the basic level. You should have a basic data, and that should run like a first migration survey, second. Then you get into what is missing. We are talking to them. We should talk to the migrants. What is missing for them when they move?
Right. Thank you so much, sir. Thank you for such an incredible, for putting the overview together, and also I think in a way complicating the picture to its the most real in its most real form. Because when we're trying to understand migration itself, I think any kind of a simplistic understanding does not come about. Like a simple solution is not going to give us the answers to all the questions that are coming up, that are going to come up in relation to migration. I would now like to move on to Mr. Libby Johnson. And Libby, dovetailing specifically into the work that Gram Vikas is doing in case of Odisha and the related corridor. Like Dr. Rajan mentioned, the diversity that comes across and the data set issues that come across, I would like to understand what has Gram Vikas's experience been in approaching migrant households in the area. Given the diversity that he was talking about, what are the groups that you are focusing on? How do you identify migrant households given the nature of mobility is so dynamic? How do you identify them, and how do you approach them in your programming? Over to you.
Thank you, Harshita. What I speak is based on Gram Vikas's nearly 4 decades of work with primarily Adivasi communities in the southern and southwestern parts of Odisha. Our focus on migration has been recent, maybe in the last 4 or 5 years. Substantially, we started looking at migration when we started looking at the younger generation and found that a lot of them were going out on a regular basis. And then we realized that what was happening was coping with the changes in the livelihood pattern, coping with climate change, as we all like to say, but also a huge amount of the rise in aspiration of these communities, where 15 years ago, a whole block had 3 high schools. Today has 1 high school in each of the 20 out of the 24 panchayats. There are 16 high schools. So education levels have gone up. People's knowledge of what is happening around us has gone up, and young people want to move out. So there is a huge aspirational push. So our work on migration has focused on the aspirational and opportunistic part. We have a huge part of Odisha, which I'm sure me also will talk about, which resorts to migration as on a distress and a huge disability, the migration disability. But the specifics that I'm talking about is from the other side, where there is a aspirational opportunistic case, a smaller in number. Where, as we see today, compared to the other forms of migration in Odisha, whether it is to Gujarat or the distress migration from Western Odisha, this is recent. This is in about last 20-22 years that this large number has started going out. Looking at markets where wage rates are much higher, as Professor Rajan just mentioned. So it is in that sense. We are talking about 22 blocks in the 6 southern, southwestern districts. Altogether, we estimate about nearly 5 lakh households. And our estimates, random survey estimates that we've done show that the interstate migration rates are between 17 to 31% in these blocks. So anywhere from 17% of the households having a migrant to 1/3 of the households having a migrant. And if you look at the migration experience in the last 10 years, the range goes up to 33% to 57% of households having had a migration experience, either seasonal, short-term, or in the interstate migration in the last 10 years. So that's the kind of numbers we are talking about. We also are trying to estimate what is the money that migration is bringing in. And the estimates that we see is anywhere from 20 crores to 60 crores per annum per block. And to give a perspective just to number, in many of these blocks, the remittances made by migrants annually is equal to what the Tritiya Panchayati Raj system is spending on development projects in those blocks through MGNREGS, through the Central Finance Commission grants and various other, Panchayati Raj sources. So that is the nature of remittances that we see that's happening. So that's the context to which I want to set in terms of where our work happens. So in terms of our work, we define every household in that block as a potential migrant, except for households which are, say, widow-headed or where old people stay alone. Any household which has a male adult, able-bodied adult male or a sub-adult male is a potential migrant. That's also because we see that 90% of the migrants are young men. The median age is anywhere from 22 to 30 years. So that's the median age of the migrants that we are profiling. So what do we work with? We do not have a benefit driven program. We have an approach where we say it's a self-selection approach. It's a demand-based approach where migrants or migrant households can come and take part in the program. The village is the unit of contact, where the household is the unit of intervention. So we look at, so what is our focus of programming is on the currently migrating worker. This is primarily the first point. They're staying behind families. The returned migrant, there are migrants in waiting, people waiting to go catch the next train and go. The village community and the Gram Panchayat. So this is the scope of our work. And within the staying behind household, which is a substantial chunk of the population that we deal with, we again have to differentiate between needs of older women, needs of younger women, needs of children, and needs of men. So we found that there's a wide range of issues and needs that these different sections have. So that's the broad design of programming in response to your question, Harshita. Right.
And like, just to point, it is so interesting, even when from an operational perspective, when you're talking about the different categories itself, like there's such new terminologies and the terms that you're referring to, even in terms of migration, those who are in waiting, those who are going, and those who are staying back. I think that itself, complicates and gives us the diversity within the migrant conceptualization that exists. I think taking a point further, Libby, I wanted to understand, so you mentioned aspirational migrants as a category that you have been looking into, that Gram Vikas has been looking into. I want to understand what are the facets of vulnerability that your program focuses on. And like you said, that would be very different from distressed migration. So how do you conceptualize vulnerability for this particular category, and how do you approach them in your program?
Yeah. So vulnerability is all pervasive, it's omnipresent. The starting point for us is that migration should not happen, that people have a right to decent livelihood where they live. They don't have to go out for that, but then that is not practical. And if people choose to migrate, then it has to become a safe and dignified migration. So the program itself we call Safe and Dignified Migration Program, because dignity and safety are the key elements. And how did we arrive at this? We started talking to people at different levels. What are the forms of issues or vulnerabilities that we face? We talked to migrating workers. They don't have enough information of what job they can get, if they go, where they can stay. They generally go because somebody from their village is in the destination state or in the destination location. So, but then they're uncertain as to what will happen. Many of them go prepared to kind of look around for 7 days, maximum 10 days, and if it doesn't work out, I'll come back. So that's the kind of attitude at the time of leaving, at the time of they're preparing to catch the train. At the destination, we find that workers face issues in terms of employers withholding their payment, not agreeing to pay what they had initially agreed to. Very poor access to healthcare because most destination places, clinics and doctors close at 6 o'clock, don't open on Sundays. Workers have only time after 6 o'clock after their work day or on Sunday. So basic services are not available. Of course, there is a lack of skills because many of them are of low educational levels, and they end up doing very menial jobs, as Professor Rajan mentioned earlier. Another set of problems that migrants reported is their difficulties in sending money back to their homes. Many of these blocks have 1 or 2 bank branches for a population of anywhere from 80,000 to 1,20,000. Bank access is very poor, so they have to do all kinds of, including carrying cash on their body, hidden inside the underwear in the train. So, we've had experiences like that. The second group that we spoke to were the wives of migrants. And there the issues came was, an inability to access healthcare when the husbands are away. They're afraid because many of them don't get to talk to their husbands on a regular basis, whether these men will go and get into extramarital affairs with others in the destination. The kids do not listen to their mothers. That's been a regular complaint that mothers, give. And they also reported a huge amount of transaction cost in trying to get money from the banks. Then we decided to speak to the mothers. The mothers also, the first problem was I'm unable to go to the the hospital, which is far away to the, if I need to. There is nobody to bring wood from the forest, especially in the forest-rich communities. There is shortage of labor for agriculture. So these are issues that mothers mentioned. When you talk to the men or the community leaders, they say that there is nobody in the village now to do the lower level jobs, the hard physical job. There is nobody to do those kind of work. So in NGNREG's work, there is fewer, hard labor available. People available to do the hard labor. There are communication problem because connectivity is an issue. They also pointed out to lavish consumption that the migrants do when they return. Boys come back with some amount of money, then they become a new kind of role model. And so around this, we decided that we would program around four aspects of security. One we called occupational security, which is about better jobs, safe jobs, and ability to deal with the employers at the destination. Emotional security for the family, for the people who stay behind, for the children. Financial security in terms of ability to make remittances easily, save money, insurance. And finally, social security, which is access to social protection schemes and entitlements, both for the worker at the destination at the workplace and also for their families that stay behind. So the programming is happening around these four aspects of safety and dignity. And we decided that it has to be a corridor approach because both the migrant worker at the destination and the family at the source or potential migrant at the source have to be part of this. So what we've done is we've partnered with organizations working with migrants or on migrant issues at destination states. So we've started on the Kalahandi Kerala corridor in the last 2 years, where CMID in Ernakulam and ISAF Bank's CSR work in Thrissur have been doing the destination level coordination. So the kind of work they do is providing information during COVID, a whole range of services, including making sure that they got ration. Now registration under the Awas scheme and the interstate migrant workers scheme of the state government, the schemes, healthcare. In the last 3 months, we've helped bring back three bodies of 3 migrants who died in Kerala. So that's the kind of coordination that's happening. And as we speak, there's a lot of distress calls that we get. There's a helpline that we run, distress call that we get that on a source destination corridor basis that we've been able to address. Finally, at the source level, we're looking at strengthening self-help groups of women, making sure that they move beyond just the thrift and credit agenda to becoming larger solidarity groups for these women, making sure that all the women are members of these self-help groups, and also expanding the footprint network of common service centers, banking correspondents, and the kind. So that is broadly the programming that we're doing overall to address some of these vulnerabilities. Thank you.
Right. Thank you so much, Libby. Thank you. I think drawing on from Libby, I would now like to move to Mr. Umi Daniel. And I think it's I go to him with this question largely because I think the context in which we are talking now becomes very interesting. So Libby has mentioned his work in Odisha and around aspirational migration in a different corridor. And moving to Mr. Daniel and his work with aided action, I would like to understand when it comes to mainstreaming and including migration, how has aided action and your work so specifically identified, approached, and also addressed the migrant vulnerabilities? And what I understand from your work is that it is a very different approach from the context Libby just laid out. So if you could please walk us through that.
Thank you, Harshita, and it's wonderful to be with Dr. Hriday Rajan and the entire panelists talking about migration and some of the work. Can you hear me? I think, is it? Yeah, it's fine. You know, we have been working with children, adolescent, and infant women who are migrating. So whenever, as Dr. Hriday Rajan has said, who are the migrants, then when you look into who are the migrants, whether they're men, women, children, accompanying or non-accompanying, where they are going, what they do, and a lot of such questions come. We don't have a segregated data also. You know, the SRAM portal has registered around 10 crores migrants by now. This portal started from September and registered around 10 crores. They're not migrant. They're all unorganized worker. And very interesting thing has come out in this. Like 94% of the workers, they said they earn less than 10,000 rupees. This is the government portal, and the government portal is talking about this. That means, and you have tribal, Dalit, and more in number and other people. So what's happening? The earnings of unorganized workers is dramatically it's going down, and the people have declared that they're not earning more. That's happening in agriculture. That's happening also with the informal sector. Now, Libby has already spoken about the 10 crores, but we have seen in 6 districts in Orissa in the western part, the amount of money being transacted to send people through middlemen. Last, I think one journalist, he came and investigated that. And we have done it some time back. We have done our study and also a film to actually unearth how much money is being transacted. So it was 2002, I think that's long back. The person said it is 50 crores, 2002. Now, Scrollin has done a story, a wonderful story. Mr. Rajshekhar was a wonderful investigator. He said, Daniel, it is 1,000 crores now. I think that much of money is being transacted to send people to only bricklins. That's Western Orissa. You know, in this area, P. Sainath has written, everyone loves a good route. These are the areas where you have seen that the distress and other conditions. And let me tell you, migration is very expensive for the poor people. They can't afford to go to Kerala unless and until they borrow, unless and until they take money or somebody has to help them to go. Huge. I know from one of the coastal Orissa, I know the other day I was there where the entire village has been evacuated because of the climate change. Entire village, 150 families were evacuated from the sea line. They were rehabilitated. And I found a very interesting thing in this village. One bus goes from here directly to Kerala twice in a week, taking people and bringing people back. And then I was curious that it is 2,000 rupees, how you're managing. Then the people said, no, we don't have money. We have to borrow. We have to, and we have to have some money for the first month. So there is poor people can't afford to migrate to a distance places unless and until there is a middleman who are actually going to actually help them. Or so there's a huge middleman who take children, women. So we started working with them long back. We work both at source and destination. At the source, we found like a lot of exploitative practices, so that how could we actually help the people. And then the seasonal hostel have come up to retain children back. So the children are not engaged, not exploited in bricklins. Then at the destination, because we have some of the places destination, we have our offices. So we started working with the children at the work site. And that's a government program now. The small model that we have created long back, and the government of India is actually running this as a government program. The SSA is actually having this wonderful program. We are sending volunteers. Interestingly, every year 50, 60 volunteers, education volunteers are sent to Bricklins in Telangana and Tamil Nadu. The government wants there to teach the children in their mother tongue. So it's basically like, we started doing this, the textbook and all. And the idea was in Bricklins and the construction sector that we are working, how women, children, women and workers could access basic social protection and entitlement from the government. And we could able to create that a sense of like people are accessing various things. And now One Nation, One Ration also we could able to include people into accessing PDS in various places. Those who have actually carried their ration card with them, I think it's wonderful to know that they could also able to access PDS. So basically, we try to work at both the end. Two things that we do. We also focus on reducing distress migration. It's not that distress migration is not happening; it is happening right there, and people are also being exploited. So there are huge government programs, I think, at the source area. All this migration that Libby is talking about, I'm talking about, are the poorest region of Orissa, where actually huge money central government has spent in the past, and also now also spending hugely. So for whose sake this money will go, where this money will go? I think there are also most vulnerable. I'm not saying we are going to reduce distress migration is happening, and some people don't want to migrate so that they can continue the migration. That we are also connecting them with various government programs so that the poor people could actually have their own. Why I'm saying, because this is a confidence I could tell you, we have rescued around 1,200 bonded laborers. They were from different Bricklins, and 70% of these bonded laborers are resettled through government money, and all people have resettled, but 70 people of the migrants are not moving again to migrate. They are not migrating. So we know that if you can provide better livelihood, land-based, other support, so people will not go. Now the children, what we do, we are also working closely with the government in 3 districts here to enumerate children, to track children, women and children, and we do kind of pre-departure orientation for women, how they will actually help their parent, help their accompanying children and others. So that we do here. At the destination also, we have been working, running this education program and all the government program. We don't run anything. All education program run by the government. The ECC component, the access to PDS, access to ICDS, access to healthcare, access to ambulance at the work site. So all these things we have started doing with the owners. Now the employers are creating a wonderful role. We have a tripartite also work going on with employers, with the government at the destination, and we, so that you could also have a kind of a program where employees could also equally could take responsibility of. So it's a huge issue on the way that on the safe migration strategy that what we are doing, also what Libby has spoken about, the safe and dignified migration, how people would also go and also earn money and come back. So the group that we are working are not having any remittances. They take advance before they migrate. So this is a different kind of migration which is taking place. And the remittances are those who send money. And we also have a large number of left behind families in villages. Left behind families are the older people, the disabled people, the various groups. So this is also another strategy that we connect them with the social protection and all. And they suffer a lot. They are the group, whether it's a remittance or non-remittance cases, these are the group are also quite vulnerable. So the migrants are vulnerable and the left behind. So we are working with these other groups, left behind, migrant, and we have the strategies like before migrant, during migration, after they come back, and we have a cycle of interventions at each stages. Yeah.
Right. I think taking on your point, I think it's really interesting with what you mentioned around the corridor approach and also the different dynamics of migration and the left behind family and the migrants themselves that are involved. Through the course of when you were explaining aided action work to us, you mentioned a lot around the role of the state here and how you're partnering with the state at different levels to channel the funds as well as make the entitlements reach to the different sets of migrants that are there. I would like to understand how do you see this expanding, the role of state and CSOs collaborating in the migration ecosystem, and also what has been the experience and how, like you mentioned, with the education work that has happened within the corridor, which if I get it correctly is the Odisha Andhra Pradesh corridor. How replicable is this kind of an MOU and bilateral tie between the other corridors that the panelists are talking about? If you could touch upon that, please.
Yeah, the MOU was a little older one. It happened between, it was a best practice that we thought that can happen between the sending and receiving state. This MOU was signed by Labour Department, and they found out money is available with both the state under the BOCW, Building and Other Construction Welfare Board, so that they could use this money for the welfare of migrant at the destination, at the work site. This has happened, and we work closely in Telangana with the Labour Department for connecting them. But the state bifurcated, and now there are two states, so the MOU is not in operation. Second is this was really good. I think we found the government has accepted that people are migrating, and there are people are also under distress at the destination. So state government initially, whatever we have done, this connecting with the social protection. Now also we are keep hearing. I can tell you a block where actually in Orissa, which is receiving migrant laborer in Brooklyn. Then we connected them with the PDS. Then the district supply inspector said, we don't have money, we don't have allotment now. So somewhere we need to see that the PDS rice has to come here to my block so that I'd be able to give to them. I was thinking, so he was saying, oh, it is a matter of 10 or 20 I could give. But when we produce that, no, it is 400 people need to be given PDS. Then I think he said, no, the collector need to be spoken now because the allotment is there, not there. Similarly, with all the ICDS and education, they said, look, I can enroll children for 6 months, but I won't be able to provide midday meal because there is a cost involved. So the migration, when we are talking about portability, so the government has to factor into this budgetary functions. They should know that, okay, like the Tiruvallur district. Tiruvallur district is a quite wonderful example where we are working with the district collector, which is receiving laborer. So the 1st of January, the collector will call a meeting of all the key departments saying that, look, we are going to serve another 5,000 people who would be coming to my district. And they are coming from other states. Now you have to prepare an action plan, which department is going to do what. But there also we found they don't have budget. End of the day, like Professor Iridhar Rajan has said, like we need to have a budgetary sanction. It's not one nation, one ration, you do that. But end of the day, the receiving area, we won't be able. So I think this is good. I think the portability and other things, what we have experienced. Now, the problem is also Aadhaar card. Now, for the midday meal now, government is asking the person, the boy or girl has to have the Aadhaar. Otherwise, we won't be able to give. So then again, these are another hurdles that we find in terms of portability. So the exclusion. These are all exclude people. Yeah. Mm-hmm. So, but there are scope is there. We have done that, and there are government is also very forthcoming, and they've also done. But yes, the major thing is that budgetary allocation. ICDS has curtailed 10,000 crores budget. So they tell us like, no, there is no budget to include more migrants. So we need to do that. I think how we would do the kind of policy work so that people source and destination, once you map out how much budget for whom, so that need to be done. This is a policy issue. Yeah. Okay.
Right. Thank you so much, Omid. I think this has been really insightful. And also when we are having a conversation on the ecosystem, how different players really speak with each other and what is the scope of collaboration, that is a really interesting aspect that's coming across. And on this note, I would now like to move to Hitesh. Hitesh works with Indus Action. And in our conversation with Hitesh, we found that now Indus Action's work is in their work around construction sector, how they are planning and expanding to integrate migrants as a front and center in their programming. So I would now leave it to Hitesh to help us understand the context of construction work in Delhi and how migration is being included in the programming that you're doing. Hitesh.
Okay. Thank you, Ashita. Thank you for the speakers as well for your insights. So I'll briefly introduce what we do at Intersaction and where the construction work related social security benefit delivery system that we are trying to work with the Delhi government fits in. So Intersaction, we work with on legislated rights, right to education, right to food, under which we work with pregnant and lactating mothers to ensure that they receive their benefits. And in the larger scheme of things, among these rights, one of the rights is Building and Construction Workers Act. As Dr. Rajan rightly pointed it out, that back when the COVID pandemic struck, everyone started thinking about migration. Exactly, that was a time when we also started thinking about the migration, because we closely work with multiple state governments in trying to ensure that the supply of delivery of social security benefit improves to whichever demography they're targeting. And that's when the conversation with the Delhi government started. How the migrants who are leaving Delhi this is during the first wave back in 2020, how they can be supported. And when they got down to working on it, they figured out only 40,000 workers were registered with the Labour Board, the Building and Construction Workers Board under the Labour Department, Delhi. And that figure is way below the estimated denominator of a total construction worker in Delhi, which is around 10 lakh workers. Of course, some people claim it's 12, 13, but the larger understanding is that the number hovers around 10 to 12 lakh in Delhi. And the first time they prioritize, then we sort of started thinking, like, how do we prioritize challenges? Because it's a massive challenge to deliver social security benefits to workers. The first order challenge was to ensure registration improves. More and more workers actually register for their construction worker certificates, so that they become eligible for the portfolio of schemes that they are entitled for, such as maternity benefits for their wife or for themselves, scholarship for their children, immediate cash benefits, which the Delhi government was rolling out at that moment, which they were calling COVID ex gratia amount. So they have sent out around 4 rounds of cash benefits of 5,000 rupees each. Currently, the construction work is banned in Delhi because of the pollution crisis. So even for that purpose, after the Supreme Court directed intervention, the Delhi government is sending again another round of DBT of 5,000 rupees to registered construction workers. So I'll briefly also, apart from the work that we do, I'll also sort of try to locate the problem of construction work within the migrant problem that we have been discussing. So according to the NSSO survey, it puts the total construction workers figure at 74 million across the country. And interstate migrant workers make 35.4% of all construction workers. This is according to the 2001 census. And one of the very interesting figures is that of all the interstate migrants in India who move out of farm sector, so construction work absorbs around 9.8% of it. So it is second to the retail sector, which absorbs all the farm migrants in the country. So now this becomes a very critical demography to support, because considering it is such a large part of the migrant worker demography, who otherwise would be part of retail, of other informal working activities. So coming back to why we focus on construction worker, considering this is a massive demography who are in the need of social security benefits. So we started working on diagnosing what the problem actually is back in 2020. We realized there are a host of problems. The top 3 were a very poorly functioning interface, whether it was offline or online. It was impossible for a construction worker in Delhi back in 2020 to get their labor card, which is in colloquial terms. Of course, technically it's called a construction worker certificate, but colloquially workers call it a labor card. And even if they get access to the labor card, it's close to impossible for them to apply for any benefit post that, which is the benefit claims. So we diagnosed multiple problems in the website, because mostly it was online, the registration process. And this is another elephant in the room in a lot of states where technology is used to deliver benefits, because if the technology is not functioning properly, there is no way any demography can be serviced by the government because of the over-reliance of technology in this case. So the best way is to either remove technology or to make sure the technology as is functioning in such a way that even the lowest common denominator in terms of literacy or semi-literate person can also operate it. So that's what we try to do. We take the second path. We try to ensure that the technology is as easy as possible, so that a worker can easily be supported by a common service center or a friend or any person in the community who even knows how to operate a mobile phone. So the first step was to start improving the tech aspect of it. So we made recommendations to the government on how the form is so long. There is no point in keeping certain categories or fields which are not required. There was unnecessary data collection in the form, and thankfully at one level, the way we were working and the minister at which is currently which is helming the Labor Department in Delhi, have aligned on the recommendations that we have been making. So that was the first step. Second step was to ensure that workers do not have to forego their wages to visit the department and get it registered, because that was taking literally their whole daily wage. So that was one important step. So doorstep delivery service was introduced by the Delhi government for construction workers, so they could easily call on a simple number called 1076 and get the labor card done. And now, after multitudes of these interventions, which includes mapping of all the labor chowks in Delhi. So the last exercise which had happened of labor chowk mapping in Delhi was back in 2008, which mapped around 120 labor chowks in Delhi, which was conducted under Delhi School of Social Work. And this time we conducted it, and we mapped close to 200 labor chowks in Delhi. Of course, there must be more, but geo-mapping labor chowks is a critical exercise because government spends a lot of money in outreach exercises to make it and to ensure that it is accurate happening in labor settlements, in labor sites, and also in labor chowks is important, because we found out that most of the people who had access to labor cards were not actually workers, and real workers in labor chowks were not aware of what a labor card is, what a social security benefit that they are entitled to is. So that was another reason we realized that it's important to map, geotag all the labor chowks for accurate outreach activities for the government. And the second thing that we realized was that all these workers, as Dr. Rajan also pointed out, Mr. Johnson and Mr. Daniel as well, that risks are very high for this demography. When the pandemic struck in the second wave, there were massive renting problem for workers because they were not able to pay their rents. Secondly, there were food issues. Schools, there were dropouts which were happening this year, and it was unbelievable what was happening at that moment. And we run a helpline for the government for construction workers, and most of the helpline questions were around food and whether they were able to pay their rent or not. So that's where we realized how important these, deliveries of ex gratia benefits of 5,000 rupees is so critical, because if you have to support the families through these external shocks, the money has to flow to the hand of the worker.
Right.
And that's why 5,000 rupee DBT became a critical thing, at least for them to pay 2 months of their rent, even if they were living in slum areas. So that was one major step that the government took. And of course, there were issues of bank accounts because the bank mergers have happened. Many, as Mr. Daniel also pointed out, Aadhaar card issues, documentation is a massive, massive problem for construction workers. Eligibility documents ranging from Aadhaar card, domicile certificates, that includes electricity certificates, etc., are hard to, for them to get. So that's where documentation is another challenge that we are dabbling with right now. But so we organized camps for all the construction workers who had not received their DBT, which was around 40,000 construction workers at that moment. I'm talking about 2021 second wave. And we were able to support around 10,000 construction workers by amending their cards, their bank accounts, their IFSC codes, etc. And this was immediately required because at that time that the magnitude of distress was at its highest. So that's what we did while working with the government. Few of the technology-based changes that we introduced was to ensure that the service of amending your form is available on the website. Previously, a worker, if he has or she has filled the form, if they wanted to amend any detail, they had to go to the district office, who would most probably charge something, right? And graft is another challenge that the government is trying to handle. So in this case, it's easily available. If a worker wants to edit their address because they move constantly, so it's easier for them to edit the address. If they change their bank accounts, it's easier for them to change the bank account. If they're interested in a specific benefit that they want, for the children for scholarship, so they can amend that detail as well. For instance, I am a construction worker. My child is now at the age of 4. Now I want to ensure that my child receives the scholarship when my child goes to the first standard, in whether it's a government school, whether it's a private school or a MCD school. So it's easier for the worker to go to the cyber cafe and get that small detail amended. So small things, making things easier for them to change details on the platform. So all these minute things play a major role in easing out the process of access. The second, sorry, do you have a question, Harshita?
No, it's with the time limit, we will have to move to the next speaker. So if you can take 1 minute to bring it all together.
Sure. So I'll summarize it. So the larger objective is to ensure that the supply side mechanism of the Delhi government in delivering these benefits become seamless. By seamless, I mean if an application is made within 60 days, the money is deposited in the account of the worker. So that's the goal we are chasing. We have kept this goal in front of us till the middle of this year, that the moment a worker applies for a claim, there are no technology-based issues, there are no process or supply side issues for them to access it. So hopefully with all these experiences that we have built up in the last 1 year, we will be able to achieve this. But happy to get in touch with all the other panelists as well, draw from their knowledge on how to sort of ensure that the social security system which the Delhi government is trying to establish reaches closer to the migrant workers and construction workers in Delhi.
Absolutely. And I think from all of us, we wish you the very best in experimenting and collaborating with the different stakeholders that are there in reaching this goal. Drawing from your point, I now move on to calling upon Varun Kapil, who works with the Tata Trust. And Tata Trust has been in the space working around migration from as early as in the 2000s. And I would want to call on Varun to talk about their experience in relation to de-risking migration. Specifically, if you can share your experience in setting up MRCs which are being scaled as best practice for de-risking migration across country right now, and also talk about the operational and scope and challenges that you've faced in doing so. Varun, I hand it over to you.
Yeah. Thank you, Harshita. Am I visible?
Yeah.
Okay. Yeah. So everyone have spoken of how the migration, various vulnerabilities which are associated and how they are getting addressed. So some of the factors, so Tata Trust started off in 2005 to work on migration. And it started off from Rajasthan itself. Ajivika Bureau was our original partner. And when we started working on the MRCs, and which are the migration resource centers and the service delivery, and eventually Tata Trust itself also took on greater initiative to work upon that. But overall, just to give you a glimpse of what all we've tried to look at is occupational hazards, risk in occupation. Sometimes it's within migration limits, or sometimes it is also local non-migrants as well. A lot of you may have heard of diseases pneumoconiosis or silicosis, which is from the dust exposure over a period of time from the work you do. So the occupational hazards is one thing that we try to look at. Second was welfare. So now any migrant worker who steps out of home, the family which is left behind, they have relatively lesser exposure to the government schemes. And that is what the MRCs try to do, these service delivery centers in the source locations. When the same worker moves out of at a destination location, that is where a worker gets exposed to various other challenges or issues. That is, for instance, health, education, livelihoods. We have acts in place. The fellow panelists spoke about that. So even residential locations is difficult to come by. So the issue of migration intertwinkles with the issue of urbanization as well, and how you are giving more inclusive spaces for migrants when urban planning is being done. So, the very basic of all the challenges is the identity issue, and the registration of migrant workers becomes a challenge, and that's been an initiative which has been taken up in varying capacities, and that was also one of the initiatives of the MRCs which were initiated, and getting a migrant card. Now, to give you an experience, if I am as a migrant traveling to another location, another city, the risk of being exposed to or you being taken up by police because you do not have an identity in that particular location and you are coming from an unorganized segment, a low income group. So the risks associated are beyond what we can think of. So, and the other aspect are related to identity again, and when you're in another state particularly, or even within states a lot of time, is your inability for basic documents to be created. Like it has been mentioned, Aadhaar card being made or a bank account being opened, which is again a prerequisite to opening or getting the portability of benefits or accessing those benefits. So PDS per se, you will not access if you move out of your village also. So interoperability or portability, a lot of these are efficiency or the systemic issues, or there is a necessity of technology being made available. Also, Mr. Daniel also spoke about how your PDS cannot be made available because there are 200 migrants. So unless and until systemically these issues are addressed, it cannot be catered to. Now, within MRC in particular, what we've tried to do is we built a platform, a mechanism, a structure on how it has to be delivered. Essentially, whatever work you do in the migration space, it is to do the facilitation to access something. So in this particular case, if you have to access social security, you put people, government systems are already established. So it is the information in access which needs to be bridged, and putting a mechanism in place where either you reach out to migrant workers or the families of the migrants when you are in a MRC setup to get the necessary information made available to them, or to get the necessary documents made for them, and then applying for the schemes. So that structure was put in place. Second was the technology portal, so that a bit more efficiency of not just capturing the beneficiary data of a migrant worker or the family, but also what are the schemes and benefits which are applicable. So building a technology platform which could help you track down that how a particular application, right from the point of filling of an application to submission of that application to a particular department, how much delays is it causing, where is it stuck? So tracking down that application, so that otherwise in a typical setup, you would see a plethora of bundles of documents being put together, and if you have to figure out that where is that particular document and for whom, you would not know what status it is in. So bringing in that efficiency, that was again the focus. And when this happened, when this particular challenge happened of COVID, so Tata Trust initiated an initiative which was done in 6 states, and it was intended to put money in hand. That was the basic objective, to provide monetary benefits. So we were able to do in several states. Some of the operational challenges that one would typically face, like one I stated as portability of benefits. So for example, in Maharashtra, migrant workers coming on a construction site, they would have access to benefit even for, let's say, scholarship or maternity benefit for a child born in, let's say, in Bihar. That interoperability of benefits is there, but that's not the case in Rajasthan per se. At least it wasn't at least a year and a half back, when even for application for a BOCW card, which is a building and other construction workers card, which is by far the most significant of all the registrations which are undertaken of unorganized workers. So there was no option of an interstate person or somebody from outside of Rajasthan. So there is no scope of getting that benefit. Likewise, the other set of challenges are like in Jharkhand, the administrative system is in itself very slow to operate compared to other states. In case of Odisha, we saw that there are 20 high migration blocks in Western Odisha. So they were, with the work that we were doing, we had set up centers, such centers in every GP. So these were eventually expanded for 20 blocks, and these high migration 20 blocks, the access to benefits or linkages to scheme benefits was done in a great scale. And along with NREGA, the focus was to get as much of NREGA benefits to these workers so that migration can also be reduced. So differences in the way the state governments also operate and those kind of challenges are related.
Right. So as you mentioned, the diversity in the way different states are operating in different ways, and the ecosystem at large in which these policies are being made and the initiatives are being taken. I also want to draw on our conversation when we were around Tata Trust work, and how you mentioned one of the critical features that while doing the operationalization of this program that you had to factor in was including the industry in this conversation. And in today's conversation, when we're trying to mainstream and understand how to de-risk migration for low-income households, I think industry also plays a very critical part and stake in the system. So could you draw on what your experience has been in getting them on board? And how do you think that, like when you're talking about the migration ecosystem and de-risking, what role do they play in making this effort sustainable?
Right. So in case of industry, most cases you would see migrants would be interstate migrants. And because typically the industry itself wants this way. Every industry wants this way, that there should not be any monopoly of people from the local population. So there is an interest, vested interest there. And when it becomes a question of inter-migrants, it is a question of political will. Eventually, these people are not your voter base. So for them to get those benefits, unless and until a political will is established of the state, of the administration, you can't achieve anything. So one aspect is obviously, even when you're talking about interstate and industry, so prerequisite to get access to or being facilitated to those benefits is to have that linkages drawn or that concern addressed. So once the government is on your side, so the other part is to look at, for example, in brick industry or construction industry where we were working. So in construction industry, you're working, you're trying to, you always have to keep in mind that whether it's brick or construction, it is the business that they're trying to focus upon. So what is their deliverable they want to achieve? And for them to achieve that deliverable, for construction to deliver work on time, or in brick to work in a conducive environment where even a small businessman like a brick owner is at peace of mind and is able to get greater productivity in work from the persons. So how that particular can be achieved. And obviously there are always certain sensitivities which are involved. So if you are able to understand what those sensitivities are, plus the profitability or the benefit to the businesses, you will always be able to win that issue. And in case of construction, if you look at it, so there is volumes of huge amounts of benefit or the to the BOCW board, the funds which are cess which is paid. Now, if that can be used for the interest of the construction company, which can improve retention of workers, then you have your job done. The companies benefit because there are limitations on the state side. The BOCW board under the Labor Department, they have their limitations to cater to such large volumes of migrant workers. To first of all, even register them is a challenge. And like Hitesh was also mentioning, that is a huge challenge. Once it is registered, then to get that benefit is another challenge. If you get that benefit, then the impact on the what we can say, the migrant workers who are working on the construction side, that will be positive. and you will see a greater continuity of the workers, which will have an impact on the improved quality of the work delivered. Likewise, if you look at brick industry, now for you to deliver, for government or for us to deliver, instead of typically brick industry is very concerned when there is a non-profit comes to them, because often it is looked from rights-based point of view that it must be related to your bonded labor, you're trying to address an issue of child labor. But if you create a conducive ecosystem and see and look at the sensitivities and other aspects, their profitability, then government can come into picture and play that again facilitation role, because right to education is also there. There are schools in the nearby proximity of brick kilns. You can link to them in that. You can also help access your nutrition for children and education also. Anganwadis can do that. They can be there are few districts in the state which have cluster of brick kilns. So if there is a political will, eventually it can be the model which we have demonstrated and have been looked up and appreciated by Lal Bahadur Shastri Institute as well. So that is something they can scale up. Mere facilitation is what would be needed, and we will be able to achieve the required aspect. So we were also able to link them to hospitals, and all the pregnant women, lactating mothers, immunization being done on the brick site. And there is a conducive ecosystem which had to be created. So we started off doing that and eventually linked to the various government benefits.
Right. Thank you so much, Varun. And well, this, bringing this entire conversation together from where we started in terms of this question of how to mainstream migration and de-risk migration, what really came through with what each of the panelists presented was, one, the point around data and identification, that the diversity, and with every operation that we were hearing about in the different states, the diversity of migrants and the categories that they present, data needs to be much more thorough in the way migrants are being identifying and being represented, not just for the state, but also for the different stakeholders in the ecosystem, like the CSO, like development practitioners, to really deliver to there in the most efficient means. Another thing that came across with the conversation was, when we're talking about de-risking and mainstreaming, is this, with every effort that the CSOs was talking about and the other stakeholders, was the need for collaboration in this space. When we're talking about the corridor approach that Gram Vikas and Umi sir spoke about, or what Varun was mentioning around MRC, there is this constant need where different stakeholders and different players need to collaborate at different scale to really bridge the gaps, that data inefficiency and other, the other gaps that exist in the ecosystem, to make this conversation going and to reach its most efficient way. And another aspect that I think which vividly came across, that how in policy domain and over the course of the last year, we've been talking about the migrant worker, and migration becomes a worker related and labor related domain. What came through with each of you, what mentioned was that it's not just the worker, it's the migrant household in its entirety, which that each of the programs is either trying to target, or even when we're talking about, Hitesh was mentioning around BOCW. BOCW is not just restricted, while it's a worker-related, labor-related domain. The claims around education, pension, go to the family members too. So I think when we're having a conversation around mainstreaming and de-risking, having a migrant household approach or understanding them through that lens is something which came across very vividly through all of your conversation. And lastly, while you all mentioned the heterogeneity in the processes that the different CSOs and ecosystem players have taken in approaching migrants, what came across was there needs to be a degree of standardization in intent and political will for this to reach in terms of it reaching the desired outcome for migrant households. On this note, first of all, I would like to thank all the panelists for taking up the time today. I would now like to call upon Rushil, who is the founder for Bandhu Urban Tech, to share his view on the panel and also share his understanding of the Migration Fellowship webinar series. Technical team, can we please have Rushil on the screen?
Hello everyone. Firstly, thank you for being here, being part of this series, and fantastic insights. Again, Libby, hi, long time. Uh, so a lot of these things that you said did resonate with us, and to kind of, I think we're kind of new kids in the ecosystem. To just tell you what Bandhu does. Effectively, we are an impact tech startup that builds technology to connect low-income workers to urban jobs and affordable housing. The idea is, if a migrant wants to decide whether or not to step out of the source area, do they have adequate information about what they're going to gain and the quality of what that is before they step out, including being able to make a decision, should I step out or not? And that is kind of where what was our thesis, and some of the things that really resonated from this panel I'd like to pick up. So as Dr. Rajan pointed out, of course, one of the big problems is the lack of data, which creates this whole problem of invisibility, also makes avoidance, or let's just say governance responsibilities, rather easy. So of course, invisibility has to go. At the same time, he suggested an interesting idea of something like an ATM card, right? Effectively suggesting a single point of access into the ecosystem that is fungible, that is mobile with the migrant worker, and not necessarily linked to all these other bundled documents. Because as we know from our experience, workers won't carry original documents with them because they are scared, including for someone who's trying to build technology like us. A migrant will say, I did not carry my smartphone because I was scared it will get stolen on the construction site. Right? So how do you, an entire ecosystem is built on an OTP-based verification and people don't carry their phones with them. How do you deal with that? So of course, there are lots of issues that come about. Mirroring, what Libby pointed out, this whole issue of safe and dignified migration. And this is something, again, we had a small experiment with Gram Vikas sometime last year, where we were also trying to figure out how much can we secure in the beginning, what is the kind of course, lots of learnings on what not to do and how to do differently. From Umi, I think one thing that does come about is, when all of us, in fact, maybe Umi, all of us are talking about a fairly successful migration corridor, which is the Odisha Kerala corridor. And successful, I'd also say, because there's a high wage differential. And while we know this is an established corridor and hence it's easier to set up secure source and destination setups, which are integrated in local networks on both sides, the idea of economic opportunity across the country and including allowing new opportunities to turn up becomes a bit of a problem. And of course, as Hitesh and Varun both pointed out, technology can play a massive role. Clearly, when you want to make such things more accessible, more democratic. So the big question, how does a migrant discover a new corridor? And is a new corridor merely discovered on the basis of its economic feasibility or attractiveness? Are we talking adequately about the social capital and community? As we know, migrants do not want to go alone. They will typically want to go with a bunch of 7 to 10 people, or they are going with a labor contractor who's typically a caste fellow or a community member. And even in urban areas, very often they are looking for a cushion, right? Even if they're making a short-term or a short distance migration, trying to seek work and having the option to go back home, that requires a cushion. So a lot of these kinds of things, and of course, contractors do provide that cushion. Lastly, of course, when you talk about construction workers and the tremendous vulnerabilities that they talk about, I do want to bring in the whole aspect that industry, how does industry also trickle down the vulnerabilities to the workers? So if a contractor is carrying them around or is the point of contact, we all know very often these are petty or small contractors who themselves do not get paid on time. And that vulnerability gets translated to the workers as well. In fact, the contractor is hedging that to retain my workers, what is the bare minimum that I need to pay them so they don't run away? At the same time, I am hopeful that my employer will pay me. And we know there's an entire new market, at least in the fintech space, the whole market where people are lending to these petty contractors as something as ridiculous as, I'd say about 6 to 12% per month. These are pretty much payday loan kinds of products. So there's an entire ecosystem that is also pandering to that. And lastly, what Varun pointed out was, while there's technology, while there are portals, while there's a lot of opportunity that technology allows for this kind of last mile connectivity, at the end of the day, we are still extremely reliant on a human face, on whether it's a CSO, whether they're CSC centers, there are migrant resource centers. And this is where I want to bring up, some of the implementation challenges, just some reflections that we've seen, and hence, some of the routes that we've taken to bring technology to this ecosystem. Again, starting with saying, yes, the corridor approach is great. To secure networks in source areas, be it employers, be it affordable housing, rental opportunities, be it access to government entitlements that are available there, access to grievance redressal, legal help. Of course, we work closely with the Ajivika Bureau in the Western Corridor in the Ahmedabad, Mumbai, the Rajasthan Mumbai sector. And of course, while you're doing that, industry on the same side is trying to get visibility into skill assessment of these workers, availability of labor. Of course, attrition remains a common issue that industry complains about. But here one may argue that there is a fundamental dissonance between the industrial time ethic and the sort of agrarian time ethic. I mean, we had evidence of a worker who was about to get finalized, go from trainee to a permanent worker, and a snake bite in the household, or actually in a neighbor's house, said, no, I don't care about this permanent employment, I'm rushing back. And of course, then project cycles, this is just a small example. So the way we think this needs to change, of course, there are so many moving parts, so many places where it can fail. So of course, we went for the lowest hanging fruit, which was people who are already making recurring trips to cities, starting rather than attempting very long distance migrations in newer corridors, looking at stuff like, can we increase the, let's say, the employment potential from a 10-kilometer distance for, say, a slum area, and enabling them access to employment in a 50-kilometer kind of radius. So of course, these are small changes, small low-hanging fruits that we're trying to solve, and then eventually start to address more pieces of this puzzle. A very simple thing industry faces, and where I see a need for technology that is that can move around the corridor, is we had a case where there was textile industry in Punjab that wanted workers. There was, of course, a big group of workers ready in West Bengal who wanted to go. The wages were right, the conditions were right, everything was checked, and they were fine on both sides. And it came down to the contractor or the main person for the workers saying that I will not move, I will not get them to board the train unless either you buy us the train tickets or you send an advance. At the same time, the employer says, I will not pay an advance till the workers arrive on my factory, right? So there's that gap, and who plugs in there? So of course, the question is, where does industry step in? Where does someone like us who's assisting this step in? And hence a system that creates accountability, that is transparent on data, that bundles all of these things. So these become free bundles that are moving around. So if there's a bundle of job, employment, and access to government entitlements, there's a bit of a price that someone pays for it. So who picks up this tab? Maybe it's a bundle, it's a tech bundle that maybe an employer can pick up, maybe a CSO can pick up. There are lots of opportunities like that. And lastly, before I wrap up, while CSCs are a great way to do this, as Varun pointed out, there is humongous potential for graft. There are a lot of perverse incentives, right from saying, if I update your Aadhaar card, you say, should I laminate it for you? It costs 100 rupees more. Or we also know a lot of the CSCs get their payment approvals, from a singular entity. And very often there is potential for kickbacks in that system. So while we have systems, last mile remains a challenge, specifically in low income, low literacy groups, where trust is still built by a human face and technology has a while before it gets there. So I just wanted to sum all of this up and say, okay, there is definitely directions in which we can move through collaborations, through mutual learnings and conversations like these. So yes, thank you again for all your insights. Yeah, back to you, Harshita.
Thank you, Rushil. We now move into the question answer session, and the team has sent some of the questions that were emerging during the session. So the first question is for Dr. Rajan. And so the question reads as, noting your work with the different data sets around migration, could you share if enumeration efforts are being made in different states are changing to include and be representatives of migrants ever since the pandemic? This is a question that's emerged for you, Dr. Rajan, if you would like to address it.
Thank you. I think, thank you very much. I think I will pick up the question. And before I speak on the question, I also, because I heard from other speakers, I just want to make one statement, because we were talking about how to mainstream migration into development. Am I right? That's what we are talking about.
Yeah.
Look at it. We had the COVID wave 1. Of course, that time is a problem of livelihoods. That's why the migration was troubled. Wave 2, there was no migration because we worried about our lives in Delhi. You know that lives itself a problem in the wave 2. We never talked about migrants. Yeah, that's a wave 1 only. And the wave 1, the Prime Minister announced 20 lakh crore package to push the industry. So many things was talked about. Nothing for migrants. If you look at it, they offered some extra money for the NREG. The finance minister came 5 times and spoke. No, that itself indicate that, you know, they are talking about NREG increasing a thing. They said talk about housing. That is the future. One ration. But what are you going to give? I did a small calculation. 200 million migrants in the country, they are paid 25,000 rupees during the COVID. Where they 3 months, they did not work. Yeah, you told them lockdown. Lockdown phase 1, phase 2, phase 3, phase 4. You would have paid them 25,000 rupees in their account. 2 things you would have got it. It created a lot of demand. And that cost will be only 3 lakh crores out of the 20 lakh crores. See, that is where we are still failing to reach the, you know, this is very important. 25,000. And then you should also got the data. How many migrants are there? See,
Yeah.
that's why I said we are not interested on migration. I think that is something I want to re-emphasize for many state government, many central government. I think many policies program, we are giving them just a lip service. Just lip service. But the COVID is gone, I don't think it is like a back to square one. Back to square one. I think this is something I want to generally on that. The migration surveys, what we do, I think we have done in Kerala, Tamil Nadu, and Punjab, Gujarat, and Goa. We are aiming to do, at least in Telangana, we are talking to people, and also probably in Odisha, we are talking to some people right now. You know, this is basically a type of. I think you can get all the reports either in my institute website or someplace. What we are interested is that we want to produce a reliable estimates based on the representative sample survey. Representative sample. So we don't go to migrant household. For example, Kerala, we take 20,000 households as a sample site. There will be a module on migration. And that module will give you, for example, how many households as a migrant, return migrant, internal migrant, return internal migrants, remittances, assets, cost of migration. Somebody is talking, use of remittances, even migration corridor. We have seen during COVID-19, the train, where to send the train, where to send the flight. We have not known the migration. We know little bit corridor. For example, a special flight came from London to Gujarat. Because not many people in Kerala in London, they are all in the Dubai. So that corridor business. And especially it was useful during the time of crisis. You know, the crisis time, you need numbers. What to do? That is where, for example, Kerala would go to the Supreme Court and tell them that we are ready with the 300,000 beds to bring back return migrants. That means even crisis period, no state, it is very sad, no state, no chief minister in India went to the PM to bring back the non-resident Indians. Why? Nobody had any data. Of course, I told the Kerala chief minister, they don't have a Kerala passport, only Indian passport. So you can't do much, you just keep quiet. You can go on writing to them, but they will do when they want to do. Because the Indian government can play a major role, because migration is again that interstate, inter-district, you know, like lot of people are involved. That's why we failed in the COVID-19, because who is responsible for protecting migrants? Nobody knows. Like, who is migrant is one question mark. Who is responsible? For example, is a state of origin, state of destination, or state of transit. See, we have 3 types of things. So unless we take up that in a very major way to get some facts about them, then only we can really mainstream them. Otherwise, we will be only talking and talking, like many government people do that.
Right. Thank you, Dr. Rajan. The next question is to Umi, and the question says, you spoke about including migrant children, women, and the overall family as a unit for de-risking migration, and the ways in which they are working, and in the way you are working towards it. Do you think the eShram portal should take such an approach as well, where not just the worker but families are prioritized? And the follow-up question to this is that what would be the challenges that such an approach might face? Umi, would you like to take that question? Are you able to unmute yourself now?
Yeah, that's what happened in the Interstate Migrant Workers Act. Whenever the labor registration happened, only they registered the men. They left out the women, even if they're traveling with them, going to work. And Orissa, again, I'll say there are 60,000 migrant registration happened. And we were looking at the register of Interstate Migrant Workers Act at the district. So only men are there and there are no one. So now the SRAM portal also, you don't have that. But certainly there's the age group that they are mentioning. And I'm really surprised to see that there are also underage children were also underage workers are also being registered there. Men, women is there. So, but yes, but when you're talking about family, how we are going to mainstream them, make all the entitlement universal. I think if you're making it universal, then I think anyone, wherever they could actually go and access. Now the BOCWs, the workers are working in Delhi. They're going back to Bihar, but they will not access that, whatever they contributed to the BOCW of Delhi, that remained there. That is not transferable. I think the money will not come back to the host, wherever the home state is there of a worker, but they're contributing hugely to that. And they're all individualized, like no entity, those who actually are traveling. So I think it's a family approach is required. Domicile, I think, is a problematic thing. Even interministerial task force, which was formed in a government is formed, they've also said that we should have the portability. And then we also discussed a lot of such issues like everyone needs an Aadhaar card to enroll into ICDS or Mother and Child Initiative or Janani Suraksha Yojana. So how can you do that? I think somewhere we need to have this family approach, and the mapping of those people need to be done. And that's very critical, which is not happening now. And finally, I think I need to also say that e-SRAM we have seen, but look, the labor codes are also going to undermine a lot on the migrant worker. That's what I have seen that. And I know I've also appeared before the Parliamentary Standing Committee to argue a better, stronger law for the migrant worker. But what we have seen today, anyone can go through that labor codes. Only 1 page or 2 pages is there for only migrant worker. Doesn't speak about much. The threshold limits are gone. Like even no one can be registered if there is a number, particular number at the destination. It was 5 was there earlier. If 5 workers are working any establishment, now the threshold has gone up to 20 now, 10 now. It was 20 they reduced. So now I think the safeguards are also required if migrant families are also moving. It's not only entitlement, but also the law need to be there that their rights and other things are also protected, and law should have all the provisions. Yeah.
Right. Thank you. Thank you so much. The next question is from Bhavani, who is a consultant at Food and Agriculture Organization, and this question is addressed to Libby. In the case of aspirational migration, has there been any case where migrants make efforts to sensitize fellow villagers and aspirational migrants about the entitlements that they may have seen locals at the destination have access to, but the migrants might not? Libby, would you like to answer that question? Yeah, please.
In certain cases, yes. We have seen several cases of groups of workers taking up issues together in terms of entitlement. So, for instance, in Kerala's case, the registration to the Awas insurance scheme.
Right.
There's a lot of group behavior that happens in that. One person comes to know about it. There's a sharing of information that happens. Unfortunately, on the source side, it doesn't happen because networks don't. It's only word of mouth network. There isn't technology to back up the the network. So that is a limitation where, telephone use is more common, where it is possible. A lot of this is happening. There's a lot of sharing within, and also see that a lot of bad things also get shared, but there are a few good things that happen between them.
Right. Thank you so much. So the next question is for Hitesh, and the question is from Priyansha, IMN's Operation and Advocacy Lead. Are there any documentation or information available on labor chocks that were mapped out? Any outputs that were publicly made available? Hitesh, are you able to unmute that? Yeah.
Yes, I have been. Yeah. Sorry, I didn't get the name of the person who asked the question.
Priyansha.
Yeah. So Priyansha, I think so we haven't made it public yet. It's not like on a public platform. We purely used it for plan the outreach activities of Delhi government, and of course we share it with our CSO partners as well when they want to execute certain campaigns, outreach activities, etc. But no, it's not public yet. But if you reach out to me, I can share my email here. I'll be happy to share it with you as well.
All right.
Yeah.
So the next question is for Varun, and this question is from Shreya at IMN. Migrants are mostly not in the mainstream, be it in the government or industry initiatives. Given that we have corporate social responsibility mandated by law in India, have there been any initiative by corporates and industry to cater to the migrant interests? Have they started thinking about it at least after the pandemic, given the degree of some visibilization that has happened since the first lockdown? Varun, would you like to take that question?
Yeah, Shreya. So there are no as such CSR driven initiatives by companies to address migration in particular. Still, migration is compared to other developmental issues, this is relatively struggling. And you would have heard from all our fellow participants or speakers rather, that how government is not moved and not enough. And I feel that even this, what happened last year during COVID and what came into limelight, that is now, you would have seen that in wave 2, the losses of lives were so much that that has also gone in the background. So maybe we are still not there to capitalize on this, all the CSR or the CSO ecosystem, the efforts which are being put. Hopefully someday it will become a greater issue. But there are standalone initiatives taken by some organizations. So for example, the Tata Realty Infrastructure Limited, they started doing initiative for the construction workers beyond using the CSR, and which goes beyond the typical work, because these workers who are formerly not your workforce under a construction industry, so you are not, if you do work for them, it goes beyond your direct mandate and it gets into the CSR mandate. So there are such individual initiatives, but not much that CSR ecosystem is doing about it. If any of the fellow panelists want to comment upon that, if they are aware of any such thing, that may be helpful.
Yeah. Would any of the panelists like to address this question? All right. Hitesh, do you want to address the question?
No, I'm good.
Okay. All right. All right. So there's another question that's coming in, and that's that's directed to Hitesh. That you mentioned using technology for quickly updating documentation like Aadhaar. Can you talk about the technology? Are you doing this using a mobile application? And which language are you using for the interface, considering migrants come from diverse states and they have different linguistic capabilities? I'll just, yeah.
So right now the interface for registration is hosted on Delhi's e-district portal. which is not very conducive for a migrant to handle actually. So there is the process of building a new website is already going on for construction workers who would want to access BOCW related benefits, and we'll closely sort of working with with the with a vendor which the government has hired for development. We'll be supporting them in design of the website as well. But yeah, so right now, so what happened initially was that we figured through our diagnostic research, we conducted a lot of primary research with workers and also frontline bureaucrats who deal with the workers. So what we learned was that the workers actually had to spend a lot of money and time as well to amend their details on the forms, because migrant workers move a lot. So someday they are in Delhi, another day in Gurgaon, in Noida. So there are a lot of construction activities happening in Delhi, and sometimes they go back to their home as well, whether it's Bihar, UP, Chhattisgarh, Jharkhand. And once they come back, they might not be living in the same house. It might be the same slum area, same working class sort of ghetto, but not exactly the same house. So the requirement for amendment is high, that demand. And it cannot be addressed by going to the district office, which most often is very far, and public transport is not, the forte of Indian cities. So therefore, ensuring that a service which allows amendment is available on the website itself was a recommendation that we had made, and then NIC was able to incorporate it in the existing portal. So now, for example, the worker can amend their bank details. They can change their photograph if it's blurry, because a lot of people might not get their 5,000 rupee ex gratia benefit if they don't get those details right. So therefore, amendment activities play a major role here.
Okay. The last question is, if more questions come, I'll address them. But the question so far is, noting the categorization of aspirational and distressed migration that were mentioned by the panelists, is there a potential for state level and center level data sets to capture these nuances and dynamics, especially if the speakers who spoke about their operations, what significance does that have for you? If anyone would like to take that question.
I can take that up.
Yeah, I think Umi was trying to say something.
Sure.
No,
Please go ahead,
Okay.
Mr. Rani. Yeah.
Hitesh.
Okay. So I don't know how far we can go with managing data sets and collecting data until and unless there is not a robust social security mechanism built around that database. Building of database is just one of the inputs that we have to conduct to match the outcome of a proper delivery mechanism, but that's only a very small step. We are seeing that in the operations of the Shram portal, where data is being collected. I think Mr. Daniel also pointed out previously, but there is not a robust social security mechanism to support the people who are in the Shram portal. Similarly, in the unorganized workers case as well, and domestic workers case as well. So data sets are already there, so we can only improve it, but building from scratch is something which I personally haven't seen much value in it, because BOCW is a database, Shram portal is a database, there are other databases existing with state and central governments.
Right. Mr. Daniel?
Yeah.
Yeah.
So how to distinguish between these two? Because distress migration is purely a developmental issue that you need to address at the source. And you have a database of those poor, vulnerable people who are either affected by a natural disaster or by economic kind of hardship, or there are other vulnerability. In coming days, what speakers were also saying, the climate change is going to trigger more migration. And then I think we'll have a development and the migration, because whether you are creating a resilient community so that they could actually face all the eventuality. That we know that migration is not only because of economic reasons only, but there are other triggers. So there you cannot have a database for everything, because government has the database of BPL. Government has, because many of these workers who are moving now are BPL families. So you can understand why the BPL family has to migrate, because the database is there with the government. The government could say how many of their BPL family have migrated, where they have gone. And if a tribal is migrating, he's losing out his tribal status at the destination. He cannot enjoy certain privileges that the person can enjoy in the village. So I think we have a development database with you, the people who are also under that, and those who are migrating out. So we need to have this interface. So I could know that in a smallest kind of panchayat area, what we are doing, we are creating the database for the Anganwadis or the Sarpanch and all, but they will be able to see that if suppose there are 15 people have migrated, what is happening to the PDS out there in the village? What's happening to the middle of children? So these are also a development issue. It's not only migration issue. That's what I think.
Right.
This database need to be looked into. Yeah.
Right. Dr. Rajan?
Yeah, I just wanted to add this database business. Maybe something we should think, because recently Surat is talking to some people, Surat municipality talking to some people, and especially the fellows who are funded by the Ministry of Housing, urban fellows. They are doing something on registering or some type of app. Then I had a lot of meeting with them. So I told them that if you want to register the migrant coming to your municipality, what is the incentive? Why should people register? Why should I tell the government I'm going from my village to some place? Why? For what matter? Why should you are again another, So unless you build some mechanism to incentivize the people to register, you are from one small panchayat in Orissa. You can mention to Orissa panchayat somewhere that I am going to Kerala. When he comes to Kerala in Kochi, somebody says, I have come from Orissa, I'm here. Why he tells that? Something happened to him. He needs health issue, he needs things like that. I think this is what you have to build in, because you should not tell please register. Why should they register? So I told them, suppose a Oriya man going to register, he arrives in, first time he is coming to Surat. You tell you can register. Why should he register? You tell him if you registered with our app, you will know where are the doctors who can speak with you in Orissa. You put them up, then you know these are the place I can get Orissa food, Orissa cinema. You should add certain, or if you register immediately, you get a Orissa newspaper online free. Something you do, all the Orissa people in Surat will register because they are getting some benefits. They have to buy Orissa Rosa. Like when you go to Dubai, Singapore, there is a India place. So India means then people go there, you want to buy a small, onion, you get that. So like that, you should incentivize people. They are special people. They are, why should they do? I think that we should think that if I am a migrant, a low-income migrant, I want to register. Why should I register? Now we should put us into their shoes. And then if you talk to them, they always ask me, sir, I have come from Tripura to here. Why should I register? Can you give me insurance? If I die, you will send my dead body to Tripura. Very simple. Yeah. You can have a group insurance. Nothing government can do. I think we should think of a very novel idea, like the corona does with the new variant. New variant, you are afraid. No, now Omicron. Like that, you should think of a very innovative idea to register migrant. You are not innovative, you are not going to get any database from them.
Right. Thank you so much, Dr. Rajan. And I think there's a follow-up question that just came through with what you were just mentioning, that could you point the audience if there is any other country which has a social security database, a robust social security database and management practice which captures migration and movement in any of the other countries for their reference? They would want to understand this better.
I don't know. I'm not sure about that, but I think what Umi was telling earlier, if you make it universal,
right?
For example, for example, in India, we don't have universal old age pension, for example. For example, if a widow is getting a pension, you should be living in the Maharashtra for 10 years. So if you make it universal, and today in this country, widow pensions are varies from 1,000 rupees to 3,000 rupees. A widow pension, a old age pension. So you should make the amount equal. And if you are universal, once you make it universal, then there is no registration comes in because there is no mean testing. Today you are mean testing. See, any program you have to be eligible to acquire that particular benefit. You are a agriculture worker, you can get this benefit. You are a construction, you join the construction thing, you get these benefits. So once they don't something like that, you can think of a universal mechanism so that people can move around it, because India is one country. Yeah. I think India is one country. Sometimes we don't realize that, unfortunately, because when I wrote an article in Indian on one of the magazine in India saying that you are prioritizing vaccine for elderly and 40 plus. I said the first you should vaccination was migrants. You know, somebody called me and asking why you are talking about migrant. What about the local? I said, you only told them they are carriers. You only told them Corona Express is coming from Delhi to Trivandrum. When you say they are the carrier, you should vaccinate them first. You did not do that. But you are forgetting they may not be locals. Not enough vaccine, but they are Indians. I told them Kerala has a special place for registering migrant workers. You know, if you are going to study, I think, you know, you should bring them in because, you know, they are Indians, man. Why are you treating them like a foreigner coming from, Rohingya coming from Burma or Bangladesh people coming from India? They are our people, man. And that attitude has to come in. They may be from Orissa, but they are Indians. Yeah, Malayali may be in Uttar Pradesh. He is Indian. That Indian, we talk too much about India, but I don't think in the heart, I don't think we are not Indians.
Right.
No, only I'll add what Dr. Rajan has said. You know, the wages are also differing. Why you don't have a universal wages across all the state? Because somebody who are coming here or wherever, they said they get better wages in Kerala. And we don't have wages here. So sometime because everything, I think universal access, I'm also talking about. So wherever people can go and have this. And also, there's a lot of other entitlement if you can make it more accessible with a limited kind, because now we are talking about so much of things like it has said you need to have an application, you need to have a Aadhaar, you need to have a lot of such conditions which are there. So it's very difficult for a poor person to carry all these things because he never flies in a flight so that he can carry Aadhaar card all the time for an identity. That's what precisely happened in one of the district. The collector said, how you expect the children to carry Aadhaar card and you are denying midday meal to them. So these are the problem. So make it more simpler, let people move, barrier-free movement that we are talking about. There should not be any barrier. And you create that environment so that people can move, access all these basic services wherever they go. And we'll have a dignified kind of life, Yeah.
I would like to, on this note, I would like to thank all our panelists and the audience who was present for today's panel. And drawing on what the note Dr. Rajan and Umi just mentioned on one barrier-free movement and communication, and also what Dr. Rajan was mentioning around universalization and the Indian identity, and you know how treating them equally. I think on this note, I would request our audience to also kind of come back to us and join us in the upcoming conversations that are going to happen through the webinar series, where exactly the intent of this webinar series is to create an ecosystem, for migration ecosystem, and a conversation among the ecosystem players, which is barrier-free, where the successes, failures, and the knowledge that is being produced by the different stakeholders in different ways can be co-shared, so that at the end, with all the good intentions that the different organizations are working with, we can just more comprehensively reach the desired intent in the ways that we are working towards. So on this note, I would like to thank all our panelists and the audience that joined us today. And I would also like to take this opportunity to thank the technical team and the team for India Migration Now and Bandhu Urban Tech, who have helped us through organizing this event. Thank you.
Thank you.
Thank you very much.
Bye-bye.
Thank you very
Bye-bye.
much.
Thank you.
Thanks a lot. Bye.
Bye-bye.